Okay, hello everybody, and welcome to our session today. Today's session is a TA session focused on data. We're going to be hearing from one of our data specialists from IDPH, Cassidy Webb, on behavioral risk factor surveillance system, BRFSS, and Healthy Illinois survey. We're really excited to be able to talk about this today. This session is recorded, and the recording will be sent out in the future. And this is made possible in part of our wonderful IDPH team and the Community Health Assessment and Planning Grant. So we're very excited to be here today. Our training team today, along with Frida Folcom and Joanne Barbell from IDPH, who are our partners in this work. We also have myself, Samantha. My name is Samantha Lasky. I'm from Illinois Public Health Institute. We are supporting IDPH and hosting these trainings. And our program associate, Jasmine Deskins, who you will see offline. If you have any tech needs or help, please feel free to message us during this time. And Cassidy Webb from IDPH. As I said a minute ago, we're going to be doing welcome, and we've just introduced ourselves. I'm going to be briefly reviewing accessing IDPH data for local health departments, and then you'll be hearing from Cassidy on both BRFSS and Healthy Illinois survey, and we'll have time for a question and answer. So during the session, if you have any questions, feel free to drop them in the chat. There's also a Q&A function at the bottom of your screen that you can use as well. And we will have questions ready to go by the end of towards the second half of the session so that folks can hear from Cassidy and we can get some of your burning questions answered about these data sets. As I noted, so this is really focused on learning how to or describing how to be able to access these data sets, who to contact if you have questions, and review and troubleshoot any questions, things that you may not know about these data sets to help you inform and improve the data collection methods for your iPlans. We have our regular group agreements. If you have been with us on previous trainings or technical assistance sessions before in the past, we ask that you actively participate. If you have a lot of questions, feel free to drop them in the chat, and make sure if you're unmuting a lot, make space or take space. If you haven't spoken up, feel free to do that during the Q&A session. Seek to understand different perspectives. Allow us to move the conversation along. Ask questions in the chat or raise your hand. If there's anything we can't address right away, we'll parking lot those items. And any questions that you ask that are either answered today or that we parking lot, we'll follow up with everyone with the Q&A sheet after the fact. And if you are, one thing that is not listed on here, if you are listed as a participant and not your first and last name, if you could please rename yourself so we can capture participation and know who we're talking to. Great. So very quickly, a quick review. So we have iQuery is a really awesome resource and really the first place we want people to look for their data. We have a new iQuery dashboard, which is really exciting. And to be able to use that dashboard, IDPH requires that local health departments have and access the iQuery dashboard by writing and signing the master data use agreement signed by your local health department administrator or executive officer. Only one agreement is needed per health department. So most health departments have actually had their master data use agreements signed, but not all. So if you're curious, I'd ask your local health department administrator, and if they haven't already completed the agreement, they can ask any questions related to the master data use agreement in that email below. This is a really long step, but really the shortened version is you can, from there, once the data agreement's assigned, request a login to iQuery. And once that account is created, you will be able to access the iQuery dashboard, which has a bunch of new information. It's very exciting. So we're excited to be able to share that today, and as a reminder for folks who maybe don't have access to iQuery at this point. If you're interested in looking on the IDPH website, if you go to dph.illinois.gov and select data and statistics and click community health data iQuery, that's how you'll access iQuery. On the site, you'll find a lot of things including a drop down to related data. And the related data also provides additional data from IDPH and other organizations that you can access, including what we're going to be talking about here today. This includes training room materials and frequently asked questions as well. If you're interested in reviewing the new iQuery dashboard and learning all that you can get out of iQuery. So with that being said, and if you're having iQuery questions, feel free to drop them in the chat. I am going to pass this over to Cassidy Webb from the division, this should say the Division of Health Policy and Data. So we'll change that, and the Office of Policy Planning and Statistics to give a presentation. So Cassie, I'll pass it over to you.
Hello, everyone. My name is Cassidy Webb, and I am the Research Scientist 2 on the BRFSS and HIL teams. So as Samantha very kindly mentioned, I will be your tour guide today through BRFSS and HIL. So if you could all keep your hands, legs, and feet inside the vehicle at all times, I would greatly appreciate it. All right, let's start. Next slide, please. So the Illinois County Behavioral Risk Factor Survey, or otherwise known as IC-BRFSS, otherwise referred to as County BRFSS, gathers information for individual counties employing the same procedures and types of questions as the CDC-administered BRFSS. The state of Illinois is one of the few states that conducts a survey to gather data on behaviors and conditions at a county level. IC-BRFSS is the primary source of county-level data on behaviors and conditions related to the leading causes of premature death for adults in the general population. Now, I know it says HIL on the screen, but I am going to keep that surprise for later, so I don't want to spoil my own fun. So next slide, please. Beginning in 1996, IDPH has completed 7 rounds of the IC-BRFSS. Round 6 was the first to make use of cell phones in the sample. Round 7, which was just recently completed, is notable in that the sample for any individual county was spread throughout the full cycle. Previously, counties were surveyed more or less sequentially over the multi-year period, beginning at the bottom of the state, and then we would work our way up. There have been some main differences between this year's reporting and the reporting of other years. So first, we have published data at the regional and state levels, and we are very excited to roll that out, along with county reports being on our website and all on one web page. So rather than you all having to toggle through multiple pages to get information, it's just all on one page for you all. And we are preparing to publish topic reports, and regional and state levels will have crosstabs that will be published. If you need that data prior to that publication, please email dph.brfss@illinois.gov, and we will be more than happy to help you with your data needs. And once again, data has been published on our website with the link right there on the screen for you all, and it will appear again later. Next slide, please. So this is kind of what I like to call a little teaser of what these new county reports look like on our web page. So as you can see on your screen, for round, you're going to want to click round 7 for the most recent stuff. You're going to want to click summary for your topic, and then you can go by geography. We just happen to use Adams as our example. And then as you all can see, it is all conveniently on one page. That way you can just copy and paste if you need to. You don't have to toggle between multiple pages and kind of Frankenstein together a document. Next slide, please. So the survey questions for the county survey comprise the BRFSS core survey questions, which combine core questions from rotating years. So some of the notable ones are health status, healthy days, healthcare access, exercise, physical activity, depression and anxiety, demographics, which does include sexual orientation, disability, tobacco use, tobacco, e-cigarette use, and marijuana use, among the others that are currently on your screen. Next slide, please. So now let's get to the fun part, which is our published data. So this is a little screen grab of our homepage for the Behavioral Risk Factor Surveillance System. On the left side of the screen, you all can see our home, our strata map, which you can click on. You can kind of go through our state map, which is kind of on the right side. You can get a look at that through the map. Our state and strata data, say that 3 times fast. Our county data, which is kind of where you guys would live, frequently asked questions, and our contact us. Now, you do see there that there is a little box that says questionnaires. We're about to get to that. Once again, I don't want to spoil my own fun. And so for our other links, we have the IDPH website. That'll take you to the IDPH main website, and then the iPlan data system. And then when it was last updated, this picture is a little bit old, like 4 years old, but it hasn't updated since then, I promise. And then you can see a little bit about BRFSS and IC-BRFSS, and then the what's available section. And once again, the website is on the bottom of your screen. Next slide, please. So now we get to talk about the questionnaires, which is a very cool topic. So if you click on the little questionnaire caret by the name word questionnaire, you can look at all of our questionnaires from our inaugural form, I believe in 1986, if I'm correct, all the way up to 2023, which is our most recent. Next slide, please. And here is the really cool part. So this is, and you're going to hear me say this is the really cool part, the entire presentation, because this is kind of my nerd thing. So you can see here that not only now do we have all of the counties that you're used to seeing, we have the entire state of Illinois and our public health regions, which include Westchester, Champaign, Marion, Metro East, Peoria, and Rockford. So now not only can you all get information about your county, you can also get information about your public health region, and you can also get information about Illinois as a whole, which is actually pretty new for us. Next slide, please. So here we're looking at our county reports once more, and this is just another example kind of our demographics and what that looks like, and then our Illinois summary. So once again, that is for the statewide. So you can look at information that has everything for our state, rather than looking at just counties. So you can compare your metrics and your numbers to what we have for the state. Next slide, please. So now let's get to Healthy Illinois. Next slide, please. So this is a lot of legalese that we have taken the liberty of highlighting the important parts. But the main gist of this is that the Healthy Illinois legislation was legislated in 2021, and it was intended to support health equity goals. Now, this is very similar to IC-BRFSS, and it has geographies of the counties, and really the goal here is to maintain county BRFSS goals. Other legislative goals include zip code and zip code groupings, highly populated cities, suburban Cook County municipalities, and Chicago community areas. So in 2021, Governor J.B. Pritzker signed PA 102-0483, which requires the Department of Public Health, or IDPH, to conduct a comprehensive annual survey of Illinois residents to provide robust and statistically reliable public health data for every county, zip code groupings in more highly populated areas, suburban Cook County municipalities, and Chicago community areas. The Healthy Illinois HIL survey will examine a broad set of social determinants of health. The results of the survey will guide policymakers, including legislatures, IDPH, local health departments, such as all of you, hospitals, and others to make informed decisions on how to best allocate limited public health resources. HIL will be replacing IC-BRFSS, and IC-BRFSS will unfortunately not be continued in lieu of HIL. Next slide, please. So these are kind of our standard health survey topics. We look to national surveys and other established surveys, such as CHIS and HCS. Feature surveys will vary topics, specifically items not included in 2024. In the coming years, we plan to work on the next survey and build a rotation plan for some core items that will routinely be collected. And the survey is designed to take about 25 minutes in total. So kind of ones that we wanted to highlight were social determinants of health on our survey, which includes things like employment, housing, and food security. Your neighborhood, which includes things like your home, your safety, your community, and transportation access. And then finally, like adverse childhood experiences, such as the experience of verbal, sexual, and physical violence in childhood. Next slide, please. So let's talk about our data timeline for HIL. So data collection is intended to be throughout the entire year. We expect surveys to start in January. So to support smaller areas that may not have enough data within the 1-year time frame, we are looking to keep the survey the same for 2 years at a time. Now, I'm sure you all are wondering to yourselves, why 2 years? Well, that reason is that so that way we can get enough data to meet our minimum requirements of statistical reliability. So that way you all can make more strong claims and you can get more information than just your usual asterisk, asterisk, asterisk that you may sometimes get because they don't meet our standards of reliability. Areas of this will better support are small counties, small municipalities, or community areas in Chicago and Sub-Cook, as well as zip codes that we want to see. Data will come back the summer following the data collection year. And the first year, we may not report all measures at all levels of geography, once again, because of those standards. The second year of data collection will be when we anticipate meeting reporting goals. So planning for 2026 and 2027 will begin this fall. Some limitations. These methods will greatly improve reporting at all levels of geography and are designed to limit the numbers of areas and measures that cannot be reported. Next slide, please. So I'm sure you guys are wondering, how do we request this magical data? Well, I would love to tell you. So to request data, please email us at dph.brfss@illinois.gov. Once again, that is dph.brfss@illinois.gov, and we will all be more than happy on our team to help you with all of your data needs and questions. Next slide, please. All right, everyone. Thank you so much for joining me on this journey. I know I didn't take the full amount of time, but wanted to give more time for that Q&A that I'm really, really excited about. Thank you for your time. Once again, my name is Cassidy Webb, and my email is cassidy.webb@illinois.gov. If you have any questions or concerns, feel free to email me at any time.
Thank you so much, Cassidy. Awesome. Wonderful. Well, thank you so much for that awesome presentation on both BRFSS and Healthy Illinois survey data. We now have time to pause and ask if anybody has any questions for Cassidy and the IDPH team. Okay, I see we have a couple questions. Thanks, Christina. One question is, for the data, can I request a separate county for combined counties?
So in the case of combined counties, which is kind of what we call our like counties like Hamilton, Wayne, for a prime example. Unfortunately, our answer is no, that is not possible. And the reason is it's due to sample sizing and are those minimum standards of reliability that we talked about before.
Another question we had come in advance was focused on some of the health departments that are doing their I plans are municipals or considered villages and not full counties. Is there any way to identify their specific data, like if they're from Skokie or something like that?
So that would probably be when those 2 years of data collection come in, because then we would really be able to meet those standards of reliability for those smaller municipalities. Like we mentioned, HIL, the main goal is really to be able to get down into those municipalities around Cook and Subcook. And so it would probably take about 2 years of data, and if assuming that it meets our standards of reliability, that's definitely something we can look into.
Awesome. Great. Um, Another question we had come in is, can I cross data by demographics?
So we are always available and more than happy to answer data requests. Once again, it's that dph.brfss@illinois.gov. However, we just want to caveat that there may be some issues with that due to our minimum standards of reliability, but we will give it a shot.
Okay. Okay, one question we had just come in about Healthy Illinois survey. How did the law come into place, and where did this come from?
So, and unfortunately, I don't know the entirety of the etiology of Healthy Illinois, but it did come from that, once again, that desire to get more information and have a wider breadth of information available, not only to us at IDPH, but also to those at local health departments, hospitals and other areas, so that way they can make better decisions about policies, they can make better decisions about future goals, and other things like that.
And folks, feel free to also, you can drop your questions in the chat, but you can also unmute yourself and ask there too. Another question in the chat, how many responses do you typically get a year based on the number of surveys?
So actually, this is something that we're very excited about here at IDPH. Healthy Illinois, we actually have gotten over 50,000 in our inaugural year, which I believe, if I'm correct, now makes it one of the largest surveys within the country of health behavior. Well, let me rephrase: largest state-based survey.
That is awesome to hear. Thank you. Any additional questions? Folks, feel free to unmute if you have a question for Cassidy. Okay, another one in the chat. What is the average turnaround time for specific requests?
So generally, that answer is as quickly as humanly possible. So generally, a day to a couple of days. We try to turn them around as quickly as we possibly can. If there's a large number of data requests that are coming in, it may be like a week to 2 weeks, but we try to keep it within the week is our general rule of thumb.
Great question. Thank you. Great. Another question is, how can the Healthy Illinois survey data be used to inform identifying priorities for the I plan?
So the Healthy Illinois survey, it delivers data at both the state and our county levels. And also it's more detailed insights at the zip code, city, legislative district, and census tract levels. So let's go a little broader. At the county level, data is available for most counties to assist with health planning, priority setting, comparing health outcomes in a multitude of ways. And it can also be used to identify trends, plan health programs and activities, and track state and local health objectives, just to give some examples off the top of my head.
That is awesome to hear. I think that the piece about identifying priorities and also helping to identify activities and strategies that could be included in action planning is probably very important for this group.
Oh, yes, we're very excited about the possibilities that HIL is going to give not only to us at IDPH, but also local health departments.
So you mentioned earlier, and I can go back for this question to the slide. Or was it? Is this? Yeah. What social determinants of health does the survey aim to collect data on, and how did you decide which social determinants to you include in the survey?
So, to answer the first part of your question, we attempt to collect data on a multitude of things, including access to health services, childhood experiences, community conditions, financial security, physical safety, and violence, to name a few. And the way we decided what to put on, especially for our inaugural survey, is we really looked into CHIS, which is the California Health Survey. We looked at Healthy Chicago. We looked at quite a few already developed surveys in order to kind of help us decide, kind of prioritize importance and what should be on the survey based upon what they have found. So we really grounded it in the work of other surveys.
That's awesome. Any other questions? Okay, one question that came in private. How is the BRFSS data weighted?
So the BRFSS data, beginning with about 2011, um, the style is raking became the BRFSS statistical weighting method. Sorry, there's a lot of S's there. Um, age, sex, categories of ethnicity, um, geographic regions within states, marital status, educational level, home ownership, and then also whether you're using a landline or a cell phone. Those are the variables that are currently used to weight the data.
Thanks, Cassidy. Folks, feel free to, I know we're hearing a lot of my voice and a lot of Cassidy's voice. So if anybody's interested in unmuting and asking a question, you can do that as well. Okay, I had one question come in actually related to iQuery, so I might tap Anna or Frida for this one. Is for iQuery, is there any data available at an individual level, and is iQuery available to the public besides local health departments?
I can answer that. So right now, iQuery is not available to the general public, because right now the data is unsuppressed for very small counts. So just to keep everyone's privacy secure, until we create a version of the dashboard with data suppression, we haven't made it available to the general public yet. And in terms of data at the individual level, again, there are definitely some privacy concerns with that and making that available. Um, and so as of right now, I don't believe we have any plans to, at any point, make individual level data available on iQuery. However, I believe if you need something like that, you can make a request to our division, and specifically, I think, Vital Statistics, and we can see about getting you what you need with that.
So thanks, Anna.
Hi, this is John Tharp at IDPH and Vital Statistics. I was the second part of the question about like record level birth and death data?
It was a more general question related to whether the data is available at the individual level or if it's publicly available, kind of the access level requirements.
Oh, okay, gotcha. Never mind. I think I misunderstood the second part of the question.
Thanks, John. Any other questions from any of our participants? One question that came in earlier was focused on the additional modules that Illinois may collect, if especially for those counties that may be bordering other states, of the optional modules that are included. Which does IDPH collect data on?
So since we've already kind of talked about HIL, I'll move over to BRFSS with that. So regarding optional modules, there are some that are on a rotation, and then some that are funded by like other programs that are within IDPH. So optional modules kind of that we've collected in the past include sexual orientation and gender identity, tobacco cessation, other tobacco use, HPV vaccination, industry and occupation. We've had diabetes. We've had prostate cancer screening, cognitive decline, and then marijuana use as kind of like a broad example of what we have collected in the past. But some are, like I said before, some are on a rotation, so they'll come up every 2 to 3 years, and then some are funded by other programs that have areas of interest.
Awesome. Thank you so much. Anybody else have any questions for Cassidy or the IDPH team? Or if you don't want to hear my voice anymore, feel free to speak up. Okay. Okay, one question came in the chat. How do you conduct the BRFSS data survey?
Okay, so we actually contract through Northern Illinois University, and they administer BRFSS kind of continuously throughout the year. So the way we conduct the survey is through random digit dialing, and they do that both on landlines and currently now on cell phones.
How is BRFSS connected to the shot and the ship? Question came.
So unfortunately, that is a little bit beyond my basis of knowledge. My knowledge is really grounded in BRFSS and HIL. But if you would feel free to email me at cassidy.webb@illinois.gov, and I can find that answer for you and get back to you within a couple of days.
Thanks, Cassidy.
Cassidy, do you want me to hop in on that one?
Sure, Kelsey, go for it.
So BRFSS is used as for some of the measures that are in the SHIP and SHA. It does some of the reporting that is available there. I think there's been county BRFSS used there before, and also with the state level BRFSS as well.
Yeah, for our last state health assessment, the data collection on our quantitative data was done by one of our UIC teams who utilize BRFSS to as part of their data sets. And that is available on the Healthy Illinois 2028 website. Any other questions?
And if you all have any questions that come up or you don't want to ask in front of everybody, once again, just shoot me an email at cassidy.webb@illinois.gov. And if I can't find the answer, I will know someone who can.
And I will put Cassidy's email in the chat. Okay, it seems like this might be all of our questions for today. I'm not seeing any further. So I think we can go ahead and wrap up today's TA session. If anybody else has any questions, like Cassie said, feel free to email her or myself. And we will be able to get any answers that we may not have been able to answer today back to you, or if something comes up later. But thank you all so much. Before you all hop off, in the spirit of giving some time back, if you could respond to our evaluation, I just shared our Zoom. That would be lovely. It helps us as we continue with our training series. It helps us identify what we can improve on, what we're doing well with these TA sessions. We have 2 more TA sessions left for the rest of the year. So if you have any questions or comments, please feel free to answer them in this evaluation. As well, there's a space for additional feedback. If you have any other thoughts on additional data sets that you would like to hear from data stewards on, feel free to add those that data, and we can reach out to the data stewards who are doing that work. So once again, feel free to take a minute before you hop off to fill out and submit your evaluation. We'll appreciate it so much. And I wish you all have a great rest of your week. I'll stay on so we can get some evaluations in. So thank you all so much. Thank you, Cassidy, for joining us today. We appreciate your presentations. Very excited about Healthy Illinois Survey, both, of course, but Healthy Illinois Survey in particular. It's very exciting
And
stuff.
thank you all for having me. This was a lot of fun to get to talk about one of some of my favorite topics.
Wonderful. Thank you all so much. Once you're done, with the evaluation, feel free to hop off. And if you have any additional questions, please let us know. I feel like I should play some jazz music as we're waiting for evaluations to come in. Thank you all for staying an extra minute and filling these out. Okay. It looks like that may be everyone. I'm gonna go ahead and end. And I hope you all have a great rest of your day and week. And thank you so much. We'll see you with all at the next session. Thank you, Cassidy.